Okay, we're good.
You good? Okay. So I'm going to play here a video of your vocal cords while you're talking and breathing. So when they close, that's when you talk, and when they open, that's when you breathe in. You're going to see in one moment is they stop being able to open appropriately. Right here, you see how they're closing up.
Mm-hmm.
That is when you were trying to take breaths in. So we call that vocal cord dysfunction, meaning when the vocal cords are supposed to open, they close instead, or they stay closed. And that can make it really hard to breathe because the vocal cords are the opening into the windpipe. The windpipe is right here. And so when the vocal cords are closed, the air doesn't flow in, and that can give patients breathing issues. We don't have perfect treatments for it, but working with speech therapists can be very useful because they can give you breathing techniques that can help break these spasms. When speech therapy alone does not work, that's when we then consider other interventions and other treatments. The one I'm recommending you to start with is something called a superior laryngeal nerve block, or SLN block for short. It's a nerve block of the sensation nerves that go into the voice box. Turns out that when you numb those nerves up, it sometimes helps the system reset so that it is less reactive, and it helps with patients' breathing. The one thing is that the nerve blocks have to be repeated around about every 6 weeks or so. So we're going to do a course of that and see if it helps. Very low risk because it doesn't lead to any sort of issues or injuries. So if it doesn't work, we just stop doing them. But if it works, then we may continue them for the breathing. There's other things that we can do that are a little more aggressive, but we would discuss those if we get to that. Does that work?